Welcome to the first day of our iCON Health Forum. Our theme for this week is going to be Take Charge of Your Health, Dementia 360. Please click on preview if you want to join the forum.
So we would like to acknowledge our iCON office is situated on the traditional ancestral unceded territory of the Musqueam, Squamish, and Skalukit peoples. I would also like to acknowledge that you are joining us today from many places near and far and acknowledge the traditional owners and caretakers of those lands. And there are a few announcements. First,
thank you very much. Thank you. I think that on screen you can, some of the participants have done this before, have joined our activities before, and today I'm just going to make a simple introduction of what iCON is all about. Hopefully that some of the participants will know. So the iCON is one of the projects initiated by the Digital Emergency Medicine of the Faculty of Medicine at the University of British Columbia. The main purpose is to help people in multicultural communities, including Chinese communities, understand how to prevent and self-manage chronic diseases by organizing health seminars, workshops, and using internet technology. We strive to share the most accurate and reliable health information with you. Not only do we hope that local people will actively participate in seminars and other activities, we also hope that the sharing of this health information can be extended to more remote areas and overseas through live webcasts and help everyone work together to improve their health. All right, first of all, I want to introduce from the lead of digital medicine, emergency medicine, and the founder of iCON, Dr. Kendall Ho, to give you a warm welcome. Kendall. All right, Barbara, thank you. Well, everyone, our friends online and the Cafe Nursing Home and the Mineral Community Center, we thank you for your active participation. I am Kendall Ho. I am at UBC. I am one of the professors at the School of Medicine at UBC, and I'm also the executive director of iCON. On behalf of the university and on behalf of the Ministry of Health, I thank you for your participation. And I know that it's been for 2 years that we've had this pandemic, so it's affecting us to the point where we have to do this online. I hope that in the near future we can sit together and then we can actively participate and know each other and know more information. And I know that today we thank you for your active and your enthusiastic support online, and then we can meet on the air. I know that there are some good friends, old friends, and there are also some newcomers, and thank you for your participation. I hope that today, this subject on the talk of dementia, we can get some insights into this issue. We also thank many media partners. They help to promote this forum, and they're also exhibitors, health exhibitors, like Barbara said just now. Those you can visit within the next month. So every time after we have spoken, we will introduce 1 or 2 exhibitors to you. And we also are very thankful for the community partners. Today, I'm not able to thank them all, so I'm not going to thank them one by one. I'm very happy that at this point in time, I know that there are many speakers who will share with us their information, and I'm not going to delay that process. But before they do that, I am very honored to be able to invite the representative from the Ministry of Health in BC as Lindsay R. Scott.
I would like to invite Ms. Lindsay R. Scott, who is the Director of Primary Care Quality and Primary Care Division of BC Ministry of Health. It's a huge pleasure to have her here join us today, and very kind to have her present to us opening remarks. So Lindsay, I'd love to pass this over to you, and thank you so much for being here.
Thank you, Kendall. Thank you for the opportunity to provide opening remarks at today's Chinese Health Forum, Take Charge of Your Health, Dementia 360. I'm Lindsay R. Scott, as Kendall said, the Director of Primary Care Quality within the Primary Care Division of the Ministry of Health. I would like to acknowledge and offer respect and my gratitude to the Lekwungen peoples on whose traditional territory I'm located on in Saanich, and to the Songhees, the Esquimalt, and Wasanich peoples whose historical relationships with the land continue to this day. I would also like to acknowledge the Métis Charter community located in Victoria. Patients as Partners is based on the motto of nothing about me without me. We believe that engaging patients and their families, healthcare providers, and community partners in healthcare is not only the right thing to do, but is an effective way to make the health system better and the people of BC healthier. Patients as Partners has collaborated and funded iCON for over 10 years with Dr. Kendall Ho as the executive director for all of that time. When iCON started, they brought hundreds of people together to learn about managing chronic diseases. And over the years, iCON has continued to bring healthcare providers to speak to people in their first languages about topics people want to learn more about. This health forum brings together a number of presenters whose aims are to increase understanding of what dementia is and how to recognize it. Importantly, they will provide resources and strategies that you and your family can use to empower and optimize your quality of life. For me, today's topic is particularly important as my grandfather suffered from dementia. Having access to today's information and resources could have increased not only his quality of life, but my family's. I want to thank iCON for bringing us together today for this discussion, and I invite you to check out their resources after the discussion. Also, take a look at our patientsaspartners.ca website for other resources and more free educational events for patients and families. Again, I want to express a big thank you to our presenters today, and I appreciate your time and look forward to learning more. Thank you.
Great. Thank you so much, Lindsay.
Thank you again, Lindsay, for this opening remark and your support. And now I will pass the mic back to Barbara, and our forum starts now. Thank you, Doctor. Today, our theme is about managing health, Dementia 360. So you can tell that we hope that we can offer a series of topics on this theme to give you more insight into this issue. And there are so many things that we're going to cover today and tomorrow. For today, we want to recognize what dementia is and what the symptoms are and how the importance of early detection and when you will need to seek help and how to treat them, how to treat it, what are the medications to treat it, and how to how to interact with patients with dementia. And for tomorrow, there is another part of this. We're going to talk about nutrition for dementia patients and their mental health, as well as their home safety, as well as their long-term care. So when the patient will need to go into long-term care and also other care aspects, which we will leave for tomorrow. To
offer more information. And now let's go to the next speaker, Kent Ling, who is a pharmacist, and he has been cooperating with us, working with us for many years. And he is sharing his special knowledge on commonly used medications for people with dementia. So Kent, well, we are very happy to hear what you have to say.
How's everyone? I am a registered pharmacist, so I'm going to share with you some information about medications for dementia. Now, we've talked about actually dementia is a combination of conditions. There are many causes. Up to this point in time, medical research has not been able to find ways to cure dementia. Now, the treatment, the purpose of that is to reduce the speed of deterioration and also decrease the burden of the caregivers. So it's not going to restore your memory, your brain functions to where it was 20 or 30 years ago. It just wants to reduce the speed. And the medications address the causes for dementia. Actually, dementia, there are many causes. There are things like Alzheimer's disease or Asperger syndrome or stroke or cardiovascular diseases which cause dementia or a combination of those. So that's like Dr. Wong said, take up about 60 to 80% of the causes. And a small portion is the dissemination of Lewy body dementia. So these also cause dementia. Now, everyone should know that cognitive dementia medications for those actually is through to hope to keep the abilities, the cognitive abilities of the patients. So if we reduce the medications that are necessary, then you have dementia onset of it. And not all the medications are effective. So you have to get prescriptions from the family doctor or from a specialist. You just can't go to a pharmacy and ask the pharmacist, what about giving me some kind of medications to treat my dementia, which I suspect I'm having. So you have to know about the medications. The doctors then will decide whether they will prescribe medications for you. Research has shown that these medications have only short-term effects. In other words, some patients, maybe since their 50s, they have the onset of dementia. And so research has shown that there's only limited effects for treating dementia. And there has been no conclusive studies that show that they have long-term effects to reduce the speed of dementia. They can reduce the speed, but in other words, they can delay the progress. But if you take it chronically, then the effect of the medication may diminish. So what is short-term effect? Now, so if you have, so if you take that for a few months, maybe you will find that, oh, your memory has improved a little bit because these long-term effects also include reducing the speed of memory loss, and dementia can progress very faster or very slowly. Of course, you want to reduce the speed of its progress, but if it does progress fast, then it could affect your self-management skills, such as bathing and changing your clothes. So you may need your family or caregiver to help you, and hopefully that we can delay these things from happening using the medications, which will produce a lot short-term results. Now, of course, like I said, the effects are limited, and there are certain side effects. And a lot of times, because as you get older, you need to take other medications as well. So these medications may have an offsetting effect with other medications. So a lot of times, doctors will recommend that you set a time limit to take this kind of medication. It's not like you take it indefinitely for 20 or 30 years. And so it depends on the personal situation to see how effective it is. So it's not something that you should take indefinitely, or maybe at a certain point in time. you will have to change to another type of medication or to increase another medications. And dementia, lots of causes have to do with Alzheimer's disease or stroke. So these medications address Alzheimer's disease and Asperger syndrome. And so you need a doctor to prescribe them. One of those is, we call it acetylcholinesterase inhibitor. It's a pretty long name. So we can see that in Chinese it's also very long. So, so it is acetylcholinesterase inhibitors. Now, which is easier, Chinese or English? I think English is easier because Chinese is actually not something that you see every day. So, but you can break down the word. So acetylcholinesterase is something that decompose, is you inhibit the decomposition, so it enhances the concentration of acetylcholine. So you reduces the density, and this medication suppresses this enzyme. So if you depress something that can dilute the acetylcholine, then that element in your body will increase. So through this decomposition, it enhances the concentrations of acetylcholine, and which slows down the decline of cognitive function. However, this medication cannot prevent your brain cells from being damaged, because as you get older, your brain cells may be damaged gradually. It can only prolong or delay the damage to brain cells, and to the point where there is not enough acetylcholine produced by your brain, then even you take this kind of enzyme, this medication is not going to be effective anymore. So in this medication, there are things that we can buy in Canada. One of that is called donepezil, and the brand is Aricept, and then there's galantamine, the brand is Reminen, and then there is rivastigmine, and the brand is Exelon. There's medical patch, which you can put on your body, and this is we're talking about rivastigmine, or the brand is Exelon. You can put on your body. It's a patch that through the skin it absorbs into your body. Now we've talked about this kind of medications. It has side effects. So all medications have side effects. So it depends on how serious the side effects are. But a common side effect or common side effects are like nausea, vomiting, or gastrointestinal discomfort, dizziness, headaches, poor sleep, or even muscle spasms. So some people who have taken this medication may be, due to these side effects, they have to stop this medication because it can affect your daily life a lot. Because if you have gastrointestinal discomfort, then you cannot eat and you cannot eat well. And so pharmacists, when we dispense this drug, we will tell them how to take it so as to reduce the gastrointestinal discomfort. A lot of times, doctors will start with a very low dosage, a prescription with low dosage, and gradually increase the dosage to a standard where it is effective, it's more effective, and it can also reduce the side effects. And some medications we call long-term appropriate so it doesn't kick in right away. It takes longer term to kick in your body. Maybe after 24 hours, it starts getting effective, and then so as to minimize side effects. We have to watch out that there's called long-acting release capsules have ER extended release. Extended release means that it releases gradually. So during that time, do not grind the capsule. It can be effective in the long-term basis, because when we design this medication, the outside or the packaging, it goes into your body through the capsule for the coating. So if you break it down, so it's not going to be effective. So it's going to be, you won't have extended release effect. And also with the medical patches, there are less chances of having nausea or vomiting. But some people may feel skin allergy after using those patches. So you can consult your family doctor whether it's appropriate for you to use patches. Say if you have eczema, maybe it's not appropriate for you to use patches. Now, we've talked about these medications, other than having side effects, also may have offsetting effects with other medications. For example, if someone has irregular heartbeat or cardiovascular disease, so they should not be candidates for these medications. Also, those who suffer from peptic ulcer should not take the medication. There was a question asked earlier that about seizures. Why would the doctor prescribe me? Why didn't the doctor prescribe me medications to control that? Because this medication can increase the chances of having relapses for those patients who have seizures. So those who have seizures, whether they are candidates to take this medication, it's up to the doctor to decide. So for those who have irregular heartbeat, they also may not be suitable candidates for that. You know that when you take the medication, so your body needs something to break it down, or so for example, your kidney, your liver has to excrete it out. So if your kidney functions or liver functions are not good enough, then you have problems with excreting that the medication. So that could be more side effects. So those who have kidney or liver diseases, maybe the dosage is lower than those who do not have those diseases. Compared with other medications, for example, and muscle reluctance, they may have offsetting effects with those as well. So there are antibiotics, for example, donepezil and galantamine. They may also have offsetting effects. So you can talk to the family doctor about that. Say if you walk into a walk-in clinic, if you suffer from mild infection, you go to see a different doctor. The doctor may prescribe an antibiotic to you. Maybe that doctor is not aware that you are already taking other medications. So those medications, chances are that they have offsetting effects, or have conflicts with the dementia medications. So you should show whoever prescribes you medications the medications that you are already taking. Other than those medications that I've talked about, Dr. Wong has also talked about Memantine. Memantine is another group of medications. Research has shown that those who suffer from middle to late stages, they're helpful to them. But for mild dementia or Alzheimer's diseases, they may not be that helpful. Obviously, that helpful. But the Memantine, they are suitable for those who have middle or late stages of Alzheimer's disease. Well, how do you know? Well, you have to ask the doctor to give you the diagnosis. Some people, because I've told you that the Diazepam and other medications may cause peptic discomfort, or maybe that medication you cannot tolerate the side effects, so maybe the doctor will change to another medication that is Memantine. The side effects of that is milder. Maybe you feel dizzy or constipation or headaches. But if you have high blood sugar, you should be careful. You can take that with food or without food, but those who have liver or kidney diseases, they are not suitable for candidates. Now, other than taking medications that can reduce the progress of brain impairment, some doctors will also prescribe some antidepressants or medications to stabilize your moods or sedatives. But if you say, oh, I only have dementia, well, how come you prescribe me those medications? I don't have mental issues. Actually, because of dementia, I mean, chronically, the patient may also suffer from depression. Maybe the mood changes will dictate that the doctors prescribe such medications, and that shouldn't be a problem. So they could effectively alleviate these problems of cognitive impairment and mood issues. So other than taking medications, is there another type of treatment? Say if I go online, Google, and consult Dr. Google, I found that there's ginkgo biloba, and there's also vitamin E or some anti-inflammatory medications. Are those effective? Actually, there are no scientific studies to support their effectiveness. On the contrary, they may have adverse effects on your body. For example, ginkgo biloba, or if you have too much of that, that has adverse effects. Vitamin E is also something that you shouldn't take too much, because your body may not be able to decompose it. So other anti-inflammatory medications such as ibuprofen may not be suitable. So if you take too much medications, maybe it will not be good for your gastrointestinal functions. So there are other ways to treat dementia and cognitive impairment. So if you need medications, then you have to consult your pharmacist. We also said that dementia is not entirely associated with Alzheimer's disease or Asperger's syndrome. For example, if you've suffered from stroke or some brain injury or cardiovascular diseases, it could affect you. It could cause dementia. So you need other medications to help you. And at the same time, you may be taking blood pressure medications or cholesterol medications or anticoagulant medications to prevent stroke. So when you get older or when you have suffered stroke, so other than taking these cognitive impairment medications, you should also be taking some other medications for your cardiovascular conditions. Actually, dementia, one of the symptoms of that is you are forgetful. Now, if you're forgetful, or if it's minor thing, that's fine. But if you forget to take your medications, maybe your other conditions, you will not be able to control your other medical conditions, and it could be dangerous. So when you have to take medications and you forget that, it is a really vicious cycle. So how do you keep remembering to take medications? I'll give you some tips. First, the most primitive way is to write that down on a piece of paper, all the medications that you're taking, and every day you open that notebook up, morning, afternoon, or evening. Sometimes you take 2 times a day or maybe 4 times a day. So you write it down. So if it's complicated, then it's more necessary to write everything down. So you can see that for breakfast, lunch, dinner, bedtime, you take 2 or you take 1. Yeah. So you can also store it in your cell phone, and you can also put it down in your, like this blister packs. You can buy that in drugstores. So it's a pack that where you can put the medications for the entire week in there, so you don't have to worry about forgetting it. So some people said, oh, some medications I take twice a day, some I take once a day, some I take every few hours. How do I differentiate? How can I remember all these details? Well, if there's such a case, you can ask the pharmacy to pack these blister packs for you for free. So you don't have to pay extra when you fill the medications. Though they can give you 4 packs each time for 4 weeks. That should be good for one month. So you don't have to remember every time, oh, when do I have to medications? Because whenever you have to take medications, you just pop out from the back and then you can take it. And the pharmacist will also evaluate which medications should not be taken with what other medications to avoid offsetting effects. So for today, that's all that I wanted. Now, I want to thank all the speakers of today, and there are also many community partners who have supported our activities. And I want to thank the Ministry of Health of BCA Patients as Partners initiative, this project to support our work. And our community as partners, there's so many partners: Mosaic, Canadian Mental Health Association, Alzheimer's Society of British Columbia, Diversity Self-Management, South Vancouver Neighborhood House, Family Caregivers of British Columbia, and RCMRG. So, and also media partners who sponsor and support our activities so that we can have such a huge audience to join us in today's forum. Thank you very much. And finally, we thank our exhibitors, our health exhibitors. Right. First of all, I want to thank the health exhibitors. What I want to tell everyone is that there's going to be a month-long exhibition there. For example, our Alzheimer's Society of British Columbia and the Canadian Mental Health Association, as well as Success and South Vancouver Neighborhood House and Richmond Gives, Family Caregivers of British Columbia, and Diversity, and our own iCON network will also display information there for 1 whole month. We also want to thank Richmond Gives, who in our community center has a viewing party. And also want to thank Cathay for hosting a viewing party. For now, that's all for today. And I will thank you in English. So remember, tomorrow, 2 p.m., we are going to continue our talks on different topics. And tomorrow, we're going to talk about nutritional knowledge on dementia, our nutritionist, Jojo, and the mental health of patients as well as their caregivers, Dr. Tigerson Young, I'm sure you know him well, and also safety and long-term care. And we have Wendy to host this talk you're all familiar with her. She's a registered occupational therapist. So I hope that everyone will join us again at 2 p.m. tomorrow on air, and we will share a lot more information with you. So hopefully we'll see you again tomorrow. That's it for now. See you tomorrow.